All right, thank you, Tim. Healthcare professionals have a friendly reminder for you. If you are having hearing and speech problems, well, it is certainly time to do something about it. Joining us, Dr. Benjamin Wycherley. Thank you for being here this morning.
Thank you.
Important topic. Tell us a little bit, first of all, what are some of the ongoing symptoms or things that folks can look out for?
One of the most common symptoms is difficulty hearing and background noise. So if you're in a restaurant and you're having trouble hearing the conversation, that's a really common situation, or a family gathering or a party or something like that.
And really interesting, when you came in, you said that there's some underlying connections. Our previous guest that we just had within the last 15 minutes was here talking about dementia. And there's some connection with hearing and dementia, you're telling me?
Yeah, over the last 5 to 10 years, there have been multiple studies that have looked at large populations of aging adults in the U.S. and have found a very strong and independent association between hearing loss and memory loss. And so if you have a mild hearing loss and you're over the age of 70, you have a double the risk of developing dementia. If it's a severe hearing loss, it can be as high as 5 times as likely to have memory loss.
Now, you might have folks sitting at home thinking, well, gee, sometimes I have a hard time hearing. How do you know when it's problematic or when you should do something about it?
Yeah, I think if there's any question, you should get your hearing tested and have a conversation with an audiologist or a hearing physician. But really, if it's impacting, your daily life, your quality of life, your work, your social interactions, if people are telling you need to get your hearing checked, or you're asking people to repeat themselves, then it's a good time to get your hearing checked and to determine if there's something that can be done to help.
Any type of preventative measures that folks can take, or things that really they should avoid or look out for?
Yeah, most hearing loss is inevitable because as we age, we lose our hearing. But there is one preventable cause of hearing loss, and it's loud noise exposure. So going to loud venues can, where if you're in a nightclub for longer than 15 minutes, you could be at risk of repeated exposures of losing your hearing over time.
So maybe a little bit important for kids, especially with the earbuds. I mean, how much does that play into effect?
It definitely plays into effect. So the risk is the duration of exposure, how loud it is, and how frequent. And most people that listen to personal devices are listening to them too loud. So if it's for 30 minutes to an hour and it's too loud, you are at risk of losing hearing. And we do think that's a significant issue as, the younger population ages, we're going to see a lot of hearing loss from that.
All right, so kids, turn down your music.
That's
Anything else you think people at home should know, how they should really take an initiative and get themselves checked out?
Well, I think it's important to recognize that hearing loss is somewhat inevitable, but it's not something that we should just accept. And so it's something that you want to engage your healthcare provider, your doctor, or if you know an audiologist or can schedule a hearing test to get your hearing tested and start the conversation about hearing loss.
Well, thank you so much for joining us. Some important information from you. Thank you.
Thank you.